as the grant maker and as a grant seeker? How does trust really change the dynamic and the outcome?
We are there for all of our partners, that we continue to listen.
If you have any challengers, they're here to help and to funders, to model that example, because it was really, it was a burden lifted off my shoulders.
In terms of the collaboration, I think that's part of that collaboration process that you were talking about, Alfred, is like, hearing from grantees, getting their perspectives, understanding these stories of impact. How does that really shape the work of our grant cycle?
Yeah, so I touched a little bit on the small grants. So for 2026, we implemented the small grants that are available for organizations, specifically in the Valley and the border areas, the border regions of the 74 counties we cover. And part of this opportunity was to try to make sure that we can have that availability for the smaller nonprofit organizations that do great work, that are boots on the ground and have been doing so for a while. And they need an opportunity to be able to demonstrate the great work that they're doing in their community. And we put it out this past year, and we were able to get successful applications through. Deborah in South Texas Diabetes Association is one of our grantees. And we're hoping that we can continue to do this so that we can continue to bring in new partners, new organizations, and help support the Valley.
And that's getting back to that smaller grant, because I know you guys applied for the smaller grant, Deborah. But one of the things you also mentioned is like, what do we fit the MHM box? How do we know? Is this the right fit? How did you guys determine that you were the right fit?
Really looking back, because what we had applied for previously really didn't fit into the overall picture of what the direction that MHM was moving in. And so I just figured we weren't going to be able to apply anymore. And after sitting down with him, he's like, no, we're really looking at the social determinants of health. You are addressing the social determinants of health in these programs that you run, focus on those programs and when you apply. And so we did. And I think one of the biggest struggles that we face as an organization for our clients is that our families, many of our Valley families, and this is just across the Rio Grande Valley, are either uninsured or underinsured, which means that they can't afford the cost of insulin. When your child has type 1 diabetes, it's not an option. You have to have insulin every day just to live, right? Just to stay alive. And so we have desperate parents come to our organization all the time, like my shipment is late, or the pharmacy doesn't have my insulin, and we're able to kind of fill that gap for them. And we try to do it with as much dignity as possible, because, it's very humbling when you're in a position of need like that. And I think being gracious and letting them know, we're a family. This is a family organization. We're here to support you. If this is what you need, then we're here to help you. And so for MHM to come in and support that so that these families can have what they need to be successful, it's like Albert was saying, we may be the boots on the ground, but MHM is the driving force behind it.
And I think it speaks again to that partnership. But I also want to mention that I introduced you as the executive director of the South Texas Juvenile Diabetes Association, but you mentioned you are a mom who also has that experience.
Yes. I founded the organization 15 years ago when my son was diagnosed with type 1 diabetes, and we didn't have any resources here in the Rio Grande Valley. So it's very personal to me. I feel a little odd sometimes sitting by people like Maggie, because I'm not a real executive director for a nonprofit. I don't know what I'm doing, but I've been doing it for 15 years because I just love our community and I love these families. And I feel like, just because we're the Rio Grande Valley, we may be rural and we may be, a little separate than the rest of Texas. We should still have everything that we need for our families to be successful. And that was something that I didn't have when our son was diagnosed. We were sent away from the Valley for treatment. And so getting to see what's happened and transpired over 15 years from just having that vision and really having the love for our community and for these families has been wonderful, a beautiful experience. I wouldn't trade it for anything in the world.
And the driving force behind your mission as well, I'm so sure, right? And taking a look, as we mentioned, being a small organization, tiny but mighty, is what we say. Reducing that administrative burden, when you're applying for grants. Tell me the benefit of that, being on with such a small staff.
It's huge. It's huge when you run into a barrier and you're able to just pick up the phone and say, I have a question, and this may be a silly question. And, to get the person on the other end saying, there is no silly questions, how can I help you? And just really guiding you through those processes is such a relief, because sometimes, when you don't have that, and most of the time you don't have that accessibility, you're kind of navigating uncharted territory, and you're going in blind, like you're trying to navigate with the lights out. And it's really difficult, because then at the end, you're doing your final report and they're like, well, you needed this and you needed this and you needed this and you needed this.
Yeah.
And when you're such a tiny staff doing so much work in the community, seeing thousands of children, it's really burdensome and very cumbersome. And so it makes you as an organization feel like, is this something I should take on again? Is this something I should apply for again? Because yes, it was beneficial to the organization and to the families that we serve, but it was such a burden for the staff that I don't know that we can do it.
Right, and that's really scary. Being grant funded is like, okay, if this is an overwhelming process and it's really going to hinder our mission, should we do this again?
Right.
Right, and being completely grant funded, again, going back to that can be detrimental when those funds are removed. But really speaking, I really want to hear from both of you is how does the funds really like this can support the goals of your organization? Maggie.
So for us, receiving the funds, it's a big support, to be honest. We wouldn't be able to do it without our partners. There's no way. Our patients cannot even pay a $40 copay. They can't. There's no way. So having that support from our funders is so important to us, because if we would happen to lose even one, we would have to be like, okay, well, we're going to have to cut out this program, or we can't see as many patients now. And we see about 3,700 unduplicated patients, but they receive about 11,000 medical visits, and not only that, we have 30,000 services that they receive throughout the year. That's like I said, including the prescription assistance, the counseling, the registered dietitian. They don't just come one time. They need to come many times, and for their follow-up, of course, and especially our patients that are chronically ill, it's something that they need to be coming in for their follow-ups. So having that help, it is so great for our patients, because otherwise they will not come, and they're not going to get it anywhere else. Mm-hmm. And I'm sure that, I'm not the only clinic that does this. There's Hope Clinic and there's Nuestra Clínica. If we don't get that help, where are the patients going to go? Mm-hmm. To Mexico? We don't know how dangerous it is over there. So there's no way. Just receiving that money is so great for our patients. And, we're very grateful. We're blessed to have that, to be able to give that help to them.
Yeah. And I will say, if I could say this, but, even coming in today, that waiting room it's not that it's empty. There's people that are definitely there that have the needs, right? That
yes,
the need is very imperative. And Deborah, same thing, I want to ask is the importance of how obviously making it easy to apply for these grants, but also how that can really help fuel the mission of the South Texas Juvenile Diabetes Association.
Well, what Maggie said really resonates, but what Albert said about being adaptable, I think, has kind of been the name of the game. Ever since COVID hit, I think all nonprofits have really had to be just adaptable, and we constantly have that memory of the possibility of everything having to shift and change overnight. And so I think that as nonprofits, we're kind of not anticipating, but we're ready, and we're a lot more prepared. So when we're talking about funding, Yes, if we lost funding, we would have to cut programs. It would impact families, but we're working really hard never to have to do that so that our families can have what they need to be successful, so that we can keep those kids out of the emergency rooms and out of the hospitals, so that we can keep families from losing their children. Because inevitably, without insulin, that is what happens to our children. You know, we can lose our children. And so it's a scary thought. You asked me what my driving force was. I did all of this because we had lost a child prior to our son being diagnosed with type 1 diabetes. And so we just were like, we can't do this again. And we aim to really change the Rio Grande Valley and offer that support so that no child would ever be lost to this disease. And so it's very personal and it's very real. And the fear that our parents face is very real on the life and death of their child.
And thank you for sharing that. I think it again speaks to that importance, but that really deep understanding of what these parents must be going through and the fears that they must be living with right now. So again, that importance, but I love thinking about there is this the learning curve here too, just for MHM as an organization. Alfred, what were some of the surprise moments that, hearing these testimonies, but also just as part of this cycle redesign, the 2026 grant cycle redesign, what were just some of those surprise moments that you guys as a staff really kind of took in?
Well, there were a few. We did host a convening here in the Valley this past summer, and we had an opportunity to not just bring some speakers to be able to share some information and experience, but also have an opportunity for our team or program officers or leadership to be able to sit down with the community organizations here and hear it firsthand and being able to make it a customized conversation about the organization, the specific organization, some of the barriers that they're facing, and then whether or not there's an opportunity for alignment. So being able to take that information and then determine what changes we can continue to make. And, as we look at our processes and how we do things, we are already talking about 2027. So we haven't even launched 2026 and we're already talking about 27. And that's just something that we're gonna see for years to come. We're gonna continue to listen to our grantees, listen to the community, and then depending on what the gaps are at that time, what the barriers are at that time, because they'll change every year, we'll try to see if we can make those changes to make it a little bit easier.
And I think what it really speaks to is to listen, to learn, and to partner, especially with those who really know their communities. And these, of course, Deborah and Maggie are just two examples of people that really know their communities and really have that intentional, the intention to listen is so important. How does trust change the dynamic in terms of just as the grant maker and as a grant seeker, how does trust really change the dynamic and the outcome?
I think it's key. If you don't have that trust, and it goes both ways, and it's not going to work out. So just in general, be honest. They're here to listen, and if you have any challenges, they're here to help. And who knows, maybe they can provide some guidance, and there's a different approach. Allow you to see it in a different approach. So if you don't have that trust, it's not going to work out.
Yeah. How about you, Deborah?
Yeah, I mean, I echo what Maggie says, but in addition to that, I think just being able to be transparent with, Albert is what led us to even applying to that grant. And, the staff has a way, MHM staff has a way of just really letting you put your apprehensions aside and lowering your inhibitions and just being transparent. He even asked me, he's like, what's stopping you from applying? And I was honest. I was like, this, and this. And he's like, okay, well, let's look at it. And he took out a notepad and he started writing things down and just really guided me through so that I could see very clearly, where we could fit in to, the mission of MHM. And I think just that that kindness and that compassion, and being able to feel like I could be vulnerable and sharing my honest opinion about where I was at and what I was capable of, is the best way to have a good outcome, but it like she said, it works both ways. I mean, Albert really helped me lower my anxiety and feel comfortable enough to actually share. And that's really what got us here. And I appreciate that. I really, really appreciate that. So to any funders out there, grant seekers out there, I agree with Maggie, be honest, allow the trust to flow, and to funders, to model that example, because it was really, it was a burden lifted off my shoulders. We are very tiny. You said tiny but mighty. Yes, very tiny, very, very tiny. And so, anything that lightens that burden and really helps us achieve our overall goals is a blessing, a huge blessing that we just are so grateful for.
I think one other thing too is just kind of speaking to that dynamic of the grant seeker and the grant maker. That is such an important relationship to have. And you're hearing these testimonies. I mean, how does that resonate, with you? I mean, just listening to these testimonies as the importance of those relationships and how that can really change the overarching vision, the mission, or not necessarily the mission, but change the way that they are able to fulfill their mission. How does that feel?
Well, first of all, they do great work. We have a little over 150, 160 grantees, and they all do great work. And I think, trust is obviously a two-way street. And, we work hard on making sure that we can show trust, that we are there for all of our partners, that we continue to listen to what they have to say, to the voice, to the changes within their own communities, because every community is going to be different. So making sure that we have an opportunity to be able to listen to them, any changes within the environment, within the funding environment, within other funders. Sometimes there can be changes within an application within one funder that can throw off quite a bit of organizations. So making sure that we're there, we can listen, we can provide support as best as we can, and make sure that we pick up the phone.
Yeah, there it is. And it's just establishing that rapport, which is key, as we're learning through this. And to wrap it up, this is to talk about the equitable grant making principles of the 2026 grant cycle redesign. I mean, and really how it's benefited, for the smaller grants, but also, standard grants. This has been a process that has been in the making, you said, since 2020, really, right? And so I know that MHM is very invested into the communities that it serves across its 74 counties. So I just want to thank you all so much for taking the time to have these conversations with us, to share a little bit more about the work, and of course, a little bit more about how MHM has really stepped in to help guide and been a little bit more of that driving force behind the mission. So I just want to thank you all again. I don't know if there's anything else anyone wants to share before we wrap up here.
No, we're just really grateful for the opportunity to be a part of this great organization and to be the boots on the ground that kind of continue to do that great work, and really, really grateful.
We're grateful to you all for having us here. And thank you again. And if you'd like to learn more about MHM and the grant cycle process, head over to mhm.org, and we'll see you next time.